Well, joining us today is Dr. June Chen, and she is with Breastlink, and Breastlink does sponsor our program, so we want to thank them for that. And they're located actually a few locations, and they do have one right here in Laguna Hills that's accessible through your bus service. But Dr. Chen, thanks for joining us this morning on the program.
Thank you for having me.
Tell us a little about yourself, how long you've been with Breastlink, and a little bit about your educational background.
Oh, of course. I've been with Breastlink of Orange for 8 years. Prior to that, I was with St. Joseph Hospital in Orange for 8 years. So I've been in the community for about 16 years.
Right.
I came from New York City. I did my medical school training at Columbia University, and then I stayed on to do residency in diagnostic radiology. And then I just loved breast radiology, so I spent a year doing a subspecialty fellowship in breast imaging at Memorial Sloan Kettering Cancer Center in New York City.
Wow.
And then I came out here.
How difficult was that choice to leave the East Coast and come all the way across country like that?
I loved New York. Well, I love New York City, but the weather here is beautiful. So it was not difficult. I have family here.
Oh,
so,
that's good. Very good. Well, how often should women have a mammogram?
So the American Cancer Society and the American College of Radiology both agree that women should begin yearly screening mammogram at age 40.
Okay.
There are some women who are at higher risk, and if you're at an increased risk for breast cancer, you may even need to start earlier than age 40. But the very latest that one should start annual screening mammogram would be age 40.
So once a year, once at age 40.
Yes.
And then self-examination is important as well, right?
Absolutely. Self-breast examination every month is very important. And also receiving a clinical breast examination by your doctor every year is very important.
Right. Especially like once you get that physical, you can still ask your doctor to check a couple of things, and then if they have an issue, they can follow up with a Breastlink or something like that, right?
Absolutely.
Now, if you have a history of cancer, especially, even if it's ovarian cancer or something like that, is it really important for them to maybe come in more than once a year?
So certain cancers increase one's risk of breast cancer, or they're associated with an increased risk of breast cancer. And you mentioned one of them, ovarian cancer. There are some genetic mutations that would involve a very significant increased risk of breast cancer as well as ovarian cancer. And so if you have a family history of a relative or a personal history of ovarian cancer or breast cancer, you really should seek counseling with your doctor and discuss it, because there are risk assessment programs and there are risk assessment models where you will have to answer a whole slew of questions about your family history and your personal history, and they can determine your lifetime risk of developing breast cancer, and also they can decide whether or not you should have genetic testing for yourself.
Interesting. Now, are there other symptoms involved? I mean, everybody knows that if there's a little lump, obviously get in right away, but are there other symptoms that somebody might be able to detect that there could be an issue?
Yeah, so there are symptoms such as nipple retraction. If your nipples start to appear pulled in, that's a sign that you need to seek additional checkup with your doctor. If you have a persistent focal area of pain that persists for 3 months, you may want to seek medical advice. Now, pain that comes and goes or moves around in your breast, that's not really worrisome. We see that very, very frequently with normal breast tissue, especially if one has dense breasts. You may have heard that term, or a lot of fibroglandular tissue or fibrocystic changes. Or if you see nipple discharge, if you see nipple leakage on its own, you probably want to seek your doctor and get some medical advice.
Anything that's out of the ordinary, I think, it's important that they get in and don't procrastinate and wait, oh, well, I just had my physical, and wait the next year or something like that. Because these things can be sometimes pretty aggressive, right? Yes,
and the key to survival is early detection.
Absolutely.
So with cancers, we don't want to ignore it if we're scared, because most of them are curable if we get to them soon enough.
Absolutely. Now, is there a certain age where women say, we're a 55 plus community, so at 50, 60, 70, do the risk factors become more dangerous for them as you age?
So the two most serious risk factors for the development of breast cancer are being female and aging. So as you can just by saying that,
Right.
your risk of breast cancer development increases
Absolutely.
as you age. So you absolutely want to continue getting your mammograms. As we age, there's more opportunity for genetic mutations to occur in our bodies. And as we age, our bodies are less capable of repairing those genetic mutations.
Right.
As I said, over the age of 40, one definitely wants to receive a screening mammogram every year. There is no upper age limit for getting a mammogram. The general consensus in the community is once a woman reaches the age of 75, she should consult with her physician, and the decision of whether or not to continue obtaining mammograms and how frequently to obtain those mammograms will be made jointly.
Right.
And much of that decision will be based on how healthy the patient is.
Right. And does medication, and I know lifestyle affects everything in your body.
Absolutely.
And medication as well, right?
Yes, and I want to just go back to the lifestyle because it's so important. We all have to age. We can't avoid that. But things that we do have control over as we age, which are important in our health and certainly in our risk factor for developing cancers, and breast cancer is one of them, is maintaining a healthy weight, getting exercise in,
Right.
limiting your alcohol,
Yeah.
no smoking.
Those are good things, right?
Yeah,
You need
those
to
are
avoid.
important for
Yeah,
all of us to
absolutely.
remember.
And when
So-
people say exercise too, when we're not talking about going to the gym and lifting a bunch of weights. It's just going for a walk,
Going
or
for a stroll.
doing whatever. Make
Yeah.
it every day or every other day something as easy as taking the dog for a walk.
Yes,
Right?
and I think you really hit upon an important point. It's consistency.
Right.
It's getting into a routine and a habit. It's not about how intense it is.
Right. At our age now, no one's trying to become Mr. Olympia.
Yeah.
They just want to make sure you get some good exercise, and moderation is the key when you're doing just about anything, whether it's eating, and alcohol even. A glass of wine might be okay, once in a while, but starting at noon is probably not a good idea.
Right.
Well, let's talk about some of the technology. You've been in this for quite a few years now, and how has radiology changed since you've seen it? Everything is advancing so much now, and I would imagine in your field it's the same.
Yes, and especially in radiology because it's very technology dependent. A radiologist, I deal with imaging, looking inside, looking at pictures, and those pictures are generated by machines. And so we've had a tremendous amount of progress in the field.
Right.
In fact, within the last decade, we've transitioned from mammograms being on film to mammograms being digitized and digital. And so we view them on a monitor, on a computer monitor, and we're able to sort of process things even after the picture's been taken to make it a better image.
Right. And could you imagine how many lives are being saved because of that? Because before, like you said, that's the old doctor thing, right? Hits the film and shoves it up there, gets that white light, and see what happens.
When I first started, that's exactly. We touched film. We would talk about hanging the films, and it's really come a long way. And most recently there's a 3D mammography. I don't know if you've heard of that.
No.
It's called tomosynthesis mammography. It is still a type of mammogram, and I just want to stress that mammography remains the gold standard for early detection of breast cancer in all ages and all populations.
Right.
So that's very important because I know sometimes we hear different things on the news, but really mammography is the only screening imaging study that has had randomized controlled trials that have proven reduction in breast cancer deaths.
Wow. Now, back in the old days too, they would say, the more concern was about the radiology, the
radiation.
Radiation. There you go. Thank you, because you said you are a professional. Thank you. You helped me out. Back then, it was different. I mean, you had to, you're wearing this big armor suit practically to get in there. It's not nearly like that anymore, is it?
No, the radiation dose is very low. In fact, it's approximately what one would receive flying from California to New York in an airplane.
Right.
So very manageable.
Very manageable.
Yeah, and certainly the benefits of undergoing a mammogram way outweigh the radiation exposure that one would be receiving.
Right. Now, you work at the Orange offices. Are you? Obviously, Laguna Hills, we really, manage the people within our community. In Orange, I would imagine you're seeing demographics from all over the county.
Yes, we do. We do, and we would welcome anybody who from this area as well, from Laguna Hills, Laguna Woods, who'd like to come to Orange.
Does ethnicity have a place in this as well? Do you find people of a certain ethnic background that have a breast cancer or cancer in general?
I think it's across the board. All women are at very high risk to develop breast cancer. Unfortunately, it's a very prevalent disease.
So
it doesn't matter what ethnicity you are. You need to get in to get your mammogram every year.
Absolutely, yeah. Yeah, it doesn't take it'll just about cover everybody. Absolutely,
yes,
yeah. It's important that everyone that gets their mammogram once a year, and it's important that they have this important information. And be sure and talk to your doctor about it each year too. If it's something, especially after the age of 40, get your mammogram done once a year. And then, like you said, our average age here is closer to 70, 75. And at that time, have that discussion with your physician, and then if they need some help, we have Breastlink located right here in Laguna Hills, and you work out of the Orange office. So 2 wonderful locations that can help you. And don't wait. That's the biggest key, I think, right?
Yes, absolutely.
Thanks so much for joining us today. Welcome out to the West Coast, even though you've been out here for, what now, 2 decades, just about.
Thank you very much.
Thanks so much for joining us on the program today. Well, that is Breastlink. They are a sponsor of our program today. They're located right here in Laguna Hills, and they do have access, too, through our Laguna Woods Village bus service as well. So be sure and stop by there. They do take in walk-ins as well, right? If somebody had an issue and they wanted to walk in, they could come and talk to a doctor right away.
Yes.
Good. Well, we'll be right back with more of our program right after this. Good job.